I wish to thank the organizers of the conference and the great opportunity for sharing Canadian forensic nursing healthcare system. I also wish to thank my longtime mentor, Virginia Lynch, because without her, I wouldn't be doing this. I am the president of the Canadian Forensic Nurses Association. I actually co-created that organization in 2006 with 3 other individuals. I work as a forensic nurse from 1992 until 2007, and I have been an educator and consultant since. Forensic nursing has changed Canada's healthcare. And the reason I know this is because I've been there the whole time. Just a quick overview first is that forensic nursing is the practice of nursing globally when healthcare and legal systems intersect. That was by the International Association of Forensic Nurses in September 2008. I am responsible for the word global. It was not in that definition, and I insisted on that word as a member of the International Association, in which I served as president in 2015. Forensic does come from the word Latin word forensis, which means honor before the forum. And right now we know that it means legal or related to the courts, which is now the accepted definition of forensics within Canada. And I also humbly acknowledge Virginia Lynch's definition, which was the very first one that she published in 1986. What makes a forensic nurse in Canada is that first there is a professional nurse education, and added onto that is the forensic science education, much like the virtual autopsy one that we just heard. Plus we've added forensic nursing education on top of that. What it comes down to is that a professional nurse, which is trained to provide care and treatment to victims both of the living and the dead of violent crimes or traumatic events. And when we say victims, we both mean victims in the same sense of the word, but also perpetrators, because forensic nursing does not have any definition without victims and perpetrators of violence. They're one and the same. A perpetrator is a victim is a victim. A brief overview of the forensic nursing specialty in Canada. The timeline actually started in North America with Dr. John Butt, who is a forensic pathologist in 1975. He hired nurses to investigate deaths in Calgary, Alberta, Canada. Some of you are familiar with Dr. Butt. He was actually the medical examiner that was in charge of the Swiss Air disaster off Peggy's Cove, Nova Scotia in Canada. That was in 1975. So that was the first time nurses and forensic came together in Canada. In 1986, Virginia Lynch presented at the Forensic Nursing Science Model at the University of Texas. And that is the beginning of the history of forensic nursing. In 1992, the International Association of Forensic Nurses was developed. And here in Canada, in 1992, it's interesting that the two formed at the same time. Canada developed 2 sexual assault nurse examiner programs. I was fortunate to be the founder of one of those programs here in British Columbia, Canada. In 1995, the American Nurses Association recognizes the forensic nursing as a specialty. Huge milestone, which Canadians have piggybacked on. And in 2006, I was also privileged to be part of forming the Canadian Nurses Association, recognizing the Canadian Forensic Nurses Association, which today has just close to 150 members at this time. We're still small. However, we are the only affiliate of the International Association of Forensic Nurses globally. So what is the difference today from the early 1990s? Before sexual, and my background is emergency nursing, so I was on the front line during these years. Sexually assaulted patients waited in acute care for many hours. We're talking anywhere from 4 to 12 to longer. Males were rarely seen by any professional if they came forward and said that they had been sexually assaulted. Often they were examined by professionals that had no or little experience in any kind of sexual violence, how to recognize findings, collect forensic evidence. That was not something that healthcare did. And also documenting of injuries was at the medical level rather than the forensic level. Today in 2021, we have in Canada, major centers and some rural areas that have 0 to 60 minutes response time for specially trained healthcare providers for all ages and genders when they report sexual assault or sexual violence. 8 of our 10 provinces have specialized programs, and 3 have provincial networks. And this is my life story from 1992 to now, 0 to 60. It does not seem like a lot, but here in Canada, it's huge. We also have courts that access objective evidence collected in the scientific manner of forensic science and nursing. And we also have community agents that collaborate before, during, and after resources for the patient who has a sexual assault. This is the biggest change that has been happened in Canada, because even our public is now aware that there is a need for specialized healthcare providers. Before, in interpersonal violence, reality was that intentional injuries and unintentional injuries were not often recognized. So if a patient said they fell down the stairs, that was what was believed. Now we know the difference between injuries that happen intentionally and unintentionally. Also in the early 90s, violence was not considered a healthcare public health issue, which has been deemed by the World Health Organization. There's specialized tools in emergency departments now to determine high risk interpersonal violence individuals. Also, the cost of healthcare. The cost of healthcare in Canada was deemed in 2011 to be over $6 billion annually. Awareness and response for the awareness and response for interpersonal violence is societal, healthcare, and public. And we now also have specialized death investigation units who look specifically at interpersonal violence death, and that is in Ontario, Canada. In child youth maltreatment, basically in the early 90s, these were undetected by healthcare providers. Injuries were deemed accidental, even if they were inflicted, and data on health and childhood injuries was very limited. In fact, my pediatric text when I took nursing in 1968 and 69 was when I got my degrees, was about a small paragraph on child injuries. That was it. Now we have mandatory reporting for child and youth maltreatment in Canada. We have specialized abuse teams that have formed and been expanded. And we also have specialized sexual violence teams, which deal particularly with the sexual component of violence. It's not as prominent in rural areas. However, in the major centers, there is response teams that deal with children from 0 to 19 years of age. In-care deaths is another huge change in the Canadian healthcare system. Usually if it was in acute care, a psychiatric unit, or corrections, the scene or the body was often altered by healthcare providers and with good intentions, but they also hampered the investigation. Care facility deaths were often attributed to natural causes, were not investigated, and coroners in Canada often do not have medical training, which means we have two systems. One is a coroner and one is a medical examiner. A coroner could be any number of individuals, not necessarily with medical training. However, a medical examiner is, of course, a medical professional. Today, we have death scene is preserved by healthcare providers who now know the difference between an investigation that is objective in care deaths. We have an awareness of the high incidence of elder abuse in care facilities, and healthcare providers are screened for criminal records prior to employment. And we have forensic nurse coroners, and we have forensic death investigators, which bring a healthcare expertise to the roles of investigating all deaths. This is a huge component where the expertise of the forensic nurse is put to use not only in the living patients, but also to act as the advocate for those who have died. Laws. Regarding laws, healthcare providers have changed from not knowing what impacts their work to knowing that they have to deal with mandatory reporting, professional practice, consent, and on the criminal laws. The difference between the criminal justice system and the civil justice system is very much in the mind of healthcare professionals now, because forensic nurses end up testifying in court, which is a big step forward from the previous to 1994, when that did not happen in Canada. Educational aspects and violence and trauma are lacking. We're lacking in healthcare, both in the basic education as well as the specialized. Today, we have forensic education in violence and trauma. It's beginning to come part of mainstream health education. However, we have forensic nursing education available in post-secondary institutions. Still limited, but at least it's there. And we have specialized courses for nurses to become forensic nurse examiners, and also in particular sexual assault nurses, as well as death investigations. So one of the biggest changes in the documentation, as an emergency nurse in the days I would write a cut to wherever, there was little correlation between the mechanism of injury and the actual injury. Documentation was often incomplete, inaccurate, inconsistent, and not always usable in court due to its lack of education. When I say these, it's not meant to be a negative. It was meant that the educational standards at the time did not meet the forensic science and the forensic nursing and forensic medicine components that we know today. So now we have many forensically trained healthcare providers in physicians and nurses who document findings objectively, accurately, and completely. They testify both in civil and criminal courts with valuable documentation, which means that the courts now have an objective and accurate way of forming their judgment. And forensic nurses routinely testify in criminal justice systems in Canada. When I look at the world of forensic nursing in Canada and I see the changes, I think of this author who's a Russian author who said, with the gift of listening comes the gift of healing. And what I also means to me that the forensic nurses of today in Canada have the time, the skills, and the ability to change the violence and trauma of the patients that they see into one that is a healing component rather than adding to their trauma. Trauma-informed care has become forensic nursing in Canada. Thank you.